Hi guys, Rebecca here with Healing Heart Wellness, and I am going to show you a quick 20-minute demonstration on how you can help your partner relax and de-stress after a long day of sitting at the computer, maybe being on the phone or possibly video games. The techniques I'm going to show you are definitely geared toward postural issues. So a lot of neck forward, a lot of rolled forward shoulders, stuff like that. The entire session is going to be with your partner sitting in a chair. A little bit about me. I am the owner of Healing Heart Wellness. I started Healing Heart back in March of 2015, and I've been a massage therapist for 8 years. I got an associate's degree at Kaiser University in massage therapy. A little bit about my business, and I will do a screen share so you can see while I speak. Healing Heart Wellness is the name of my company. I also go by Healing Heart Massage, mainly because the main thing that we offer is massage therapy. However, I wanted to offer potential for growth. So I decided on Healing Heart Wellness. However, if you Google Healing Heart Massage, Healing Heart Wellness, you're going to find me. And this is geared towards our couples classes, which is a part of the massage therapy portion of the business. My website is healingheartmassagetherapy.com. You can reach me via phone or text at area code 321-345-7124. And you can email me at mobilemt333@gmail.com. I'm on LinkedIn. If you search Rebecca Freehill, owner at Healing Heart Wellness. And I'm also on YouTube under Healing Heart. And you can see my logo is my YouTube picture. I'm also on Facebook. You can search Healing Heart Mobile Massage Therapy, and you'll find me on Facebook as well. So back to me here. If you have any questions, I do ask that you write them down or type them in the chat box. And during the demonstration, I won't be able to answer them. So at the very end of this meeting, we will do a question and answer portion, and then you can get your questions answered at that time. A little bit about when you shouldn't receive massage, and they're called contraindications. A local contraindication would be a specific area that is inflamed. So if, let's say, your shoulder is sore and it's hot and it's swollen, that's probably a local contraindication, and you wouldn't want to massage directly on that area. If you have any kind of open wound or any kind of rash, especially any kind of contagious skin condition like shingles, you want to avoid that area. However, you can still massage around the area. Another type of contraindication is a systemic contraindication. And in a situation like that, that means that you shouldn't get massage at all. Something like if you're running a fever, if you're on chemotherapy for cancer or radiation or something like that, it's not a good idea to get massage. If you have a health condition that you believe might be a local or a systemic contraindication and you don't know, please check with your doctor or do some research and be your own healthcare advocate before you proceed. So definitely proceed with caution. I definitely don't have time to go into all of the ins and outs of massage therapy. So just so you know, this is not going to certify you to be a massage therapist. You will not be able to give these massages and charge for them because that is illegal. I am certified in Florida and in the state of Maine to give massages. And I've been certified long enough in the state of Florida to actually be able to teach massage. However, this is not a certified massage class. This is just me showing you a few tips on how to work on a loved one, be it your boyfriend, your husband, wife, it could be a parent and a child situation, a best friend, just somebody that you love. This is going to give you a few tips and tricks on how to help them relieve some stress and maybe feel a little bit of pain relief at the end. Some of the tools that you're definitely going to need would be a chair with a low back or a stool. For the purposes of the demonstration, I'm going to use a office chair which swivels. And that is because my partner, I'm going to be moving him around. And I do have another camera that I'm going to activate when we start. So you can see different points of view. And a stool would be appropriate too. Also, a bed, table, or desk would be helpful. My partner is not going to do this, but as you can see, I'm sitting in front of my bed. And if your partner wants to, they can use a pillow and they can lay down and get comfortable. So that's the purposes for having a low bed or chair. You do not want a high chair. I have a high top behind me. Basically, unless you're like super duper tall, having a high top chair is just going to be way too much stress on the person who's giving the massage. So you don't want to be, you know, having to keep your arms up too high for too long. You want to be able to put your body weight into it and you want to be comfortable. It's always easier to get into a low stance on a low stool than it is to deal with somebody that's sitting up really high. Definitely have lots of pillows and bolsters. A bolster would be like what the therapist uses on the table underneath your knees or your ankles to support your legs when you're laying down getting a massage. If you have any of those will work too. So make sure you have lots of pillows or bolsters around for support, just so that the person receiving can get nice and comfortable. An extra stool or two might be beneficial for the person giving the massage in case they want to prop a leg up. Just to make it more comfortable for the person giving, because the person giving doesn't want to be stressed out. They won't want to give a massage for very long if it's hurting. So we want to try to make everybody comfortable and happy, and then the massage will happen a lot longer. A few extras that you could invest in but are not required. Hot stones. As a massage therapist, I do have an industrial hot stone, hot towel cabbie for warming them, but you can actually purchase a little mini warmer on Amazon. There's a little clamshell one that's probably no bigger than my hand, and it fits just a couple of stones on there. And it's nice for rubbing on to get the muscles nice and loosened up before you start actually working on them. Bring some blood flow to the area, kind of, like preheats the person's body. Some hot moist towels are another nicety. You could warm them up in the microwave, make sure they're not soaking wet, and make sure they're not super hot. They do also sell like towel steamers on Amazon. They get really hot though, so be very careful with those. And then you could just use it to place around their neck. Wet heat is always really good for releasing super tight muscles. If you do use some oils or creams, it's nice for wiping it off afterwards so that they don't feel greasy. For the purposes of the demonstration, my partner is going to keep his shirt on, but if you're in a situation where you're comfortable, the person receiving the massage can feel free to take their clothes off or wear a tank top or just a bra or something like that. And then you could use some massage oils or creams to do a few different things. For those of you that may have arthritic issues in the hands and you just can't work your joints all that well without them hurting, investing in a little massage tool would be nice. This little one here, I got in a little Christmas gift, a little like a bath set. And it's just got these little roller balls on it. They have ones that kind of look like claws with little knobs on it. You could get one of those. And it's just so that you can roll on the tissue. The ones with the little claws, they wouldn't roll, but you could just press in with it and also slide it along the tissue. Those are helpful if you have arthritic issues in your hands and wrists and it hurts you to give massage. I will go over a few techniques once my partner is on the chair, and you'll be able to see a few techniques using the forearms and not the tip of the elbow, not the very, very tip, but like the flat part of the elbow right here. Some essential oils are also nice. I have a whole arsenal of essential oils. That's just totally a matter of personal preference as far as what essential oils. Some that are really beneficial for relaxing are lavender and chamomile are very, very relaxing oils. So if you're looking for something to try to bring down the person so that they're not super stressed out and frazzled, then lavender and chamomile are two very good choices for that. And you can use those neat, which means you don't have to dilute it first. You could actually rub some on the neck and the back of the skull, maybe a little on the temples, just to kind of get the person to, get started on the relaxation process. So I am going to go ahead and switch my camera over and bring my partner into the chair. All righty, and we are good. This is my partner, Andy. He is my boyfriend. And like I said, if you want to have your partner lean forward onto something to get comfortable, you put some pillows in front. You could have them straddle the chair back so that they can get closer, if that's desired. But for the purposes of the demonstration, he's just going to sit upright the whole time. Sorry, Andy. And before we get started, I am going to show you on the Muscle Man the areas that we're going to be focusing on today. Mainly, we're going to focus on this back muscle right here. It's sort of a diamond shape. It goes from the neck to the shoulder and then down to the back, mid back, and it does the same thing on the other side. So it's kind of like a diamond in the back. It's called the trapezius muscle. It's the most superficial muscle we have, and it's the main muscle in the back of the neck and shoulders that we're going to be working with, and also a little bit here into the neck area. This muscle right here called the sternocleidomastoid, and basically it attaches the collarbone and the sternum here, and then up into the jaw. So the main muscle in the neck area that we're going to focus on is this little area right here. So without further ado, we will talk about some ergonomics. So like I said, we want to make sure that the person giving the massage is comfortable along with the person receiving the massage. So I'm going to spin Andy around here to the side so I can show you that his shoulders are a little bit greater than 90 degrees, as you can see from my elbow. If I rest my hands right here, it's not quite, this would be like a 90-degree angle. He's a little bit greater than a 90-degree angle. So he's a little on the taller end of somebody sitting in the chair. If he had been sitting in a high top, he would be up here. And it would be like me just using a lot of wrist, hand, and shoulder. With him down here, I can get a little bit lower and I can push my forearms into his traps, into his shoulders. And I wouldn't want to stand like this, because that's going to put a lot of strain on your low back, and you just don't want to bend forward at the hips for too long. So you want to make sure you get in some kind of stance. I'll back up a little bit so you can see like a stance like this. It's almost like a warrior in yoga. You could also stand like this, horse stance. It's like a yoga pose. It's called horse stance. So if you need to get low, it's always easier to get low than it is to get high. No pun intended. So if you need a stool, here's my ball. If you want to sit down behind the person, if you're working lower in the back, you could totally sit down and work back in here, and work lower in the back too, because like I said, that trapezius muscle moves down to the back. All right. So making sure that you are not bending forward at the hips, your hands are not too high, that you are in a comfortable stance, and that you get into some appropriate stances, so that way you're putting more of your body weight into it instead of your shoulders and your hips. So Andy's pretty comfortable, making sure that you have lots of pillows and stools if needed. If he tells me he's uncomfortable or if he needs a pillow, we'll put a pillow behind him. Check in with your partner, making sure that what they're feeling is good. I will check in with Andy throughout to make sure nothing that I'm doing is hurting him. And we'll go ahead and get started. So the first part we're going to work on here is the back, that back part of the trapezius. I'm just going to start by kind of superficially rubbing to bring some blood flow to the area like this. And I'm going to turn around just a little bit more, just so you can kind of see a little bit better. There's a bone, big old bunch of bones here called the spine. You do not want to press right there in the middle. And there's also, if you run your hands along your partner, you'll feel a bony, almost like a spine right here, and it's actually called the spine of the scapula. And this is a bone too, and digging into these bony prominences are not going to feel good. So if you run your hands on, find the bone and then just go just off to that, that's where the muscle meets the bone at the tendon, and usually it feels really good to push in there a little bit. So I'm going to go ahead and just start by very carefully rubbing. This is called petrissage. And again, if you have some kind of arthritic issue and doing this motion with your hands doesn't feel good, you can grab your tool and you can roll it. You can roll it on the tissue. Again, don't roll it on the palm. That's going to hurt. You just want to kind of lightly roll down and ask, is that pressure okay? You like the pressure. Don't be scared to ask them. The first few times that you do this, you're going to want to check in with your partner to make sure that the pressure is okay. So that's if you wanted to use the tool. If you had one of those claw tools, you could just, you know, work it down, just making sure you're not pushing on any bones. So I'm going to keep rubbing the upper part of the shoulders here. And I don't have any problems with my hands, so I'm going to go ahead and just use my hands for this. And you just wanted to bring some blood flow to the area. Now I'm going to take my forearm, the flat part of my forearm, not my elbow, and I'm going to kind of just push out. Making sure you're not pressing into any bones or anything. And just push out. I'm kind of pushing, I'm pushing down and out. Down and out. The pressure okay? Mm-hmm. Okay with the pressure. I'm going to do the other side. You always want to make sure you do both sides. You want to make it balanced. We're not getting into any kind of like pain relief issues right here. So as a massage therapist, sometimes I do things where I only work one side of the body if it's for a very specific condition. But for the purposes of this demonstration, we're wanting to do the same thing on both sides. Now I'm just going to kind of press lightly on the top of his shoulders. Again, just bringing blood flow to the area, maybe getting into some of those pressure points. I'm going to squeeze down sides of his shoulders. These muscles are called the deltoids. They're those muscles that kind of come out like this, like shoulder pads. They're the shoulder pad muscles. Make sure I'm getting into a good stance here. And again, if your hands are not happy with this, get your tool and you can roll down. You can roll down, you can roll side to side. Whatever feels good, you can roll up. Just do what feels good to you and check in with your partner and make sure it feels good for them too. Okay, now what I'm going to do, I'm going to swing him back to the side a little bit. And we're going to do something called a trapezius pull. So that diamond muscle right here kind of wraps around to the front. What I'm going to do is I'm going to hold his, I'm going to hold it like this. I'm not going to stick my fingers in like that because I do have a little bit of fingernail going on here. And if you have an arthritic issue, you're probably just going to need to avoid this one altogether. So I'm just going to kind of grab, and I'm pushing in with my palm to squeeze that muscle to kind of get that tissue right in my hand. It doesn't hurt. Does that feel okay? Mm-hmm. And then I'm just going to gently pull up. So I'm grabbing it and pulling up. And try and raise that tissue. And by doing this, from a myofascial perspective, you're going to interact with the muscles deeper than the chest because the tissues are connected by connective tissue. So anytime I refer to myofascial release, which is what this is, I'm interacting with that fascia. And that's the connective tissue that runs from your skin all the way down to your bones from head to toe. It's a massive labyrinth together. And I'm just going to go ahead and petrissage it again. And then we're going to go ahead and do a little bit more forearm. I'm just going to press down. Checking in, making sure you're not pressing on any bones. If you accidentally smack your partner in the face a little bit during this, that's okay. You're just learning. Just don't hit them too hard. And we're going to go ahead and we're gonna go ahead and tie this area up. I always do a little superficial before and after just to let my partner know that I'm done. Obviously, when you practice this with your partner later, you can make it longer. But we're just doing a little quickie demonstration. So now I'm going to spin him back around again this way. And we are going to work in the back of the neck, up into the scalp, and possibly here into the temples as well. So basically what I like to do is if you can get their shirt down a little bit, try and do that. If you want to use massage oils, that's great too. And I'm just going to do the same thing that I was doing with my hand movement like this. I'm going to do it to the side on both sides of his neck. Just kind of squeeze and pull. And I'm just trying to pull that tissue back. Trying to grab the tissue and then pulling it back towards me. And you could even do it with your hands like this. Grab one side and the other and do it like this, where your knuckles are kind of like on the sides of his neck here. And you're pulling. You can pull it back. You can pull it out to the side and forward. And if you want to, you can use the tool. If your hands hurt, you can just run the tool up and down the sides of his neck. Now you can go a little bit on the side too. You don't want to rub it on the front part of his neck because there are some very, very sensitive areas in the front part of the neck. So you don't want to like be running that right here in the front part of your neck. But on the sides and in the back is okay. Keep doing this, and I'm gonna roll my fingers up a little bit into his scalp like this. As you can see, I'm just doing this in a circular motion. It's like a hand puppet. A lot of this is hand puppet stuff. And then I like to put my fingers in right here. There's a meaty part right at the base of the scalp where the head meets the neck. I put my thumbs in here, and then I put my fingers up top. So my fingers are up here. I have thumbs over here by the temple area. My thumbs are down here at the bottom. And then I'm just gonna roll my thumbs around. Plant my fingers in here, and there's some pressure points up in here too. So that's gonna feel good too. Thumbs a little bit. Let me get forward. And then I'm gonna roll my fingers. I'm gonna keep my thumbs still. And now I'm gonna roll my fingers. I'm gonna do both thumbs and fingers together. And then from there, you can just kind of go all over the scalp. There's really no wrong way to do this scalp. But some attention to it. Love behind whatever it is. Just do this. That's probably not going to feel too good. Try to get into a rhythm. Put some music on. It's really nice, soft, relaxed music. If you're having trouble finding your rhythm, and go to the beat of music. That's always a rule of thumb, to go to the beat of whatever song you're doing. And now I'm just going to come up here, get into his temples a little bit more. And then just going to pass with my hands on his head, and then down his shoulders, and then down the back. And that's kind of how I like to tie in both of those. So now I'm going to turn Andy around, and we are going to work the front part. So one of the reasons that a lot of people feel stress in the behind back in here is because of posture. So most of us are driving, we're on our phones, we're on computers, we're just always slumped and forward. So our heads like this, our shoulders are like this. So we can work the back here, and it'll feel really good. But what we're going to do here in the front's a little bit different. So I'm going to have Andy put his hands down by his sides, and his palms are going to be forward. And just like in that muscle man picture I showed you, his hands were forward. They were in fists to show the extensors, or the flexors, but we are going to have his palms open. And the reason for this is called anatomical position. And you can see my shoulder, when I do this, my shoulder actually kind of comes forward. And then when I do this, my shoulder kind of comes back. So just by him being in this position, his shoulders have gone back to the position that they're supposed to be in. So that's already stretching this tissue to where it's supposed to be. And while he's in that position, I'm just going to lightly massage down here in the chest. The chest muscles are called the pecs. And I didn't show you on the Muscle Man the pecs. I should have. I'll remember that for next time. But I'm just going to use my palms and my fingertips, and I'm just lightly pressing in and down. Okay, I'm not doing this. I'm not poking at them, and I'm not like, you know, sticking my fist in them. I'm just lightly pressing in and down, just trying to get that tissue to stretch a little bit because it's really tight right here. Some people, it might be so tight it's ticklish, they might giggle a little bit, and that's okay. If it's ticklish, generally you can go a little harder. Just make sure that it doesn't hurt. Is this pressure okay? Does it tickle? No. No? Okay. So while he's in this position, I'm gonna put my whole body up against him, and then I'm gonna put my palms right here. So this is the shoulder, like feel for the bony area, and then right in here is like a little divot. And I'm just gonna kind of hook my palms into that area, and I'm just gonna try and lightly bring my hands, both of my hands back like this. So I'm gonna lightly try and spread out these pec muscles and bring his shoulders back a little bit. This is also a myofascial release technique. I'm just gonna hold, just see if it'll stretch open a little bit. You may not be able to feel the stretch, but that's okay. Just hold it for, you know, 30 seconds or so. Just have the person breathe normally. They don't have to do anything special. And then when you're done, you want to come back slowly. You never want to recoil back really fast. Then I'm going to massage it a little bit more, bringing some more blood flow. And now what I'm going to do is I'm going to grab his arm. Now you can put your other arm however is comfortable for you. We're done with that. I'm going to take his arm. I'm not going to hold it right at the wrist or above the wrist, a little bit below the wrist here. We don't want to traction that wrist too much. And I'm just going to shake it lightly just to make sure that he's not helping me and letting it go. Because if I was to drop his hand, I would want his hand to just go down. So if the person that you're doing this with is like this, you might want to shake them a little bit or tell them to play dead or something like that. Whatever you need to do. It may take a few sessions before they get used to it, but it'll eventually get there. So, and then from in here, you can, when the arm is up like this, you can work a little bit deeper into the pecs. So you have the big pec muscle here, which is the pec major, and then underneath into the armpit area is the pec minor. That's the actual muscle that brings the shoulder forward. So when it's tight, it's going to do this. Even if you're trying to keep your shoulders back, as soon as you don't think about it, boom, it's going to come back in here. So I'm going to lightly just run my fingers, and you can use your tools. Get your tools. If this hurts, you can use your palm. And I'm just going to push, and I'm going to push it down, kind of pushing it towards his nipple while I'm supporting his arm right here. Now, if this is uncomfortable, you can grab the arm like this. Make sure you get into a decent stance. Make sure he feels like his arm is supported, and you can do the same thing. Just push it down. Now, if you have a female in a chair and it's not somebody that you're intimate with, you will have to adjust a little bit. You probably can't go this long. You may just get a work up in here. That's okay, because it comes all the way up the shoulder. But since he is a dude and he is my boyfriend, I am going to go ahead and push all the way down there towards the nipple. But professionally speaking, I can't do that. All right. And then I'm going to lightly, within his tolerance, bring his arm back. Is that comfortable? Mm-hmm. Okay, so we're doing a light stretch. Now this would be similar to a doorway stretch where you put your arms in a doorway and you lean forward. So I'm going to hold his arm like this, and I'm going to pull his arm back. You feel a stretch? Yep. He feels a stretch, so I'm going to stop right there. If you're pulling back and they start to resist, you're probably going too far back. Go a little bit forward until they stop resisting and just hold it there and ask if they feel a stretch. Some people feel like they need to feel a super duper hard stretch before they say yes, they feel a stretch, but they don't have to. And you can also go on the inside of the arm like this because those biceps and all those arm muscles definitely interact with the shoulder girdle too. So while the arm's up in the air like this, Just doing a little bit of squeezing, or if you have your tool, you can roll your tool up the arm. Just be very careful. Here in the armpit, there's a lot of lymph nodes. You don't want to dig or get real deep into the armpit. You want to keep it superficial right here on the chest area, okay? I'm going to gently put his arm down into a comfortable position, and then I'm going to grab the other arm and do the same thing. Lightly shake it. Okay. And then do the same thing. Let's just rub down. We're pushing down, trying to stretch this tissue out. We're massaging, but we're also stretching. Emphasis a little bit more on stretching. The massage helps to relax, but the stretching is really what we're needing, because this area here is tight from being shortened all day long. I'm going to bring his arm up, squeeze a little bit, do the same thing. Right. And I would normally do that side a lot longer. For time purposes, we're going to do that doorway stretch again. You feel a stretch?
You go a little bit further.
Okay. See? Feedback. Very important. If you're the one receiving the massage, make sure you're giving your partner feedback so that they know. How's that? He feels a stretch. He didn't feel a stretch before. And that's really important. And then anytime you come out of a stretch, you want to go slow. You don't want to go super fast, because muscles can recoil and spasm. And that's not something that you want to do. Now for the front part of the neck, we are going to switch the video camera again, just because it's a closer camera. So hi, we're up close now. All right, so I'm gonna bring it forward a little bit more. Okay, so I'm gonna spin you maybe a little bit that way. So the area of the neck we're gonna work, sorry if I pinched you, is right in here. And we're up in Maine, so he's got layers on. So if you're watching from a cold area, you can relate. If you're watching from a warm area, well, you'll have to wait till summer for me to do my tank top demonstrations. So in the neck area, you don't want to work here in this front part of the neck. And you can feel, if you put your fingers in here, you can feel where the pulse is, okay? There's some really sensitive areas in here that you want to be careful of when you're working the front part. But that doesn't mean you can't work the front of the neck. There's lots of muscles, and that sternocleidomastoid one that I showed you comes down to right about here, and it comes up the front part of the neck, and it comes up here to the jaw. So this is it's called the sternocleidomastoid, or the SCM. And all I'm going to do is I'm just going to lightly rub more of the side of his neck, a little bit into the front, because I want to interact with that muscle. And when I'm all done with him, I'll show you a little trick that you can do to make the SCM pop out on yourself. Once you get used to doing it on yourself, you can try it with your partner. So I can feel here, you will feel it. It's kind of like a little meaty, rolly type thing right there. All the muscles are meaty rolly things. So I'm just lightly pressing. Does that feel okay?
Feels great.
Okay. Most people are really tight and short in here, so it is actually going to feel really good. And most of us don't massage this part of our neck. We're always rubbing the back because it usually hurts in the back, but it hurts in the back because there's something pulling in the front. Or vice versa, might hurt in the front because there's something pulling in the back. And I'm going to go all the way up. Be careful behind the ears, because there is a little mastoid process back in here that's very tender. You don't want to dig in or anything, but I'm going to lightly rub. I'm going to scoot them again more to the side so that you can see back in here, the base of the ear, where the sternocleidomastoid. I'm gonna follow it all the way down to that area right in here. And now I'm gonna do right here on the collarbone area. This is where it inserts. So if you put your fingers right where the collarbone meets right where the collarbone meets the sternum right here, you'll feel like these little bumps. And if you just kind of like gently press in just slightly there and push down, they might feel it stretch up in here. You feel that stretch up by your ear?
No, but it feels good.
They may not. You could also do a pin and stretch. I'm looking at the wrong camera. You, you can also, I'm like, why? You could also do a pin and stretch where you hold it right here and you hold it here and you pull. So you're gonna pull this one up and you're gonna push that hand down. So you're gonna basically stretch both sides to try and stretch that muscle out. It's very superficial. If they're super duper duper tight, you're gonna feel it pretty quickly. If they're not super tight, they're just massages, or if they meditate daily, like my boyfriend does. He doesn't get massages daily, but he meditates daily. So his tissue is actually pretty good in this area here. He's not like super tight like some people. I definitely want to do the other side. Want to leave him unbalanced. Good. Good. And then I'm just going to kind of go back to doing that same thing. Now, I consider this the anterior neck. Anterior means the front. So even though I'm kind of on the side, I'm still a little bit more toward the front. Don't be scared. Do it on yourself first if you're unsure and you're not comfortable doing it on your partner yet. That's okay. Just go ahead and practice on yourself and you'll eventually get comfortable at it. So good. And then just like I did with all the other things, I'm gonna lightly, superficially do this to let them know that I'm done. And boom, and it's done. So now I'm gonna have my partner Andy carefully stand up because his blood pressure is probably a little low. Just getting some body work done. And I'm going to show you guys a little trick on how to make that sternocleidomastoid pop out. So what you do is you're going to try and turn your head to either side, but you're going to hold, you're going to resist. So I'm going to try and turn my head to the left, my left. I don't know what it's going to show up on the screen. It's probably going to look to the right. So turn my head to the left. And as you can see, that's the sternocleidomastoid popping up on my neck. That right there. That right there is your sternocleidomastoid, the tendon that comes down to the collarbone, or sorry, the sternum. And as you can see, it goes all the way up here. On yourself, okay, you can grab it. So, and now that I've got it, I'm able to let go. I'm not flexing it anymore, and I've got a hold of it. If you feel a pulse, grab somewhere different. Don't grab it there. If you feel a pulse, you can go up, you can go down, but generally speaking, you should be able to grab this muscle after some practice, let go of the thing, and then eventually over time, you'll be able to gently pull it and stretch it. Okay, so that is your sternocleidomastoid, and that is how you grab it onto yourself. And I'll show you the other side. So same thing with the other side. I'm trying to turn my head to the right, but I'm resisting. I'm putting my hand here and not letting my head go, just enough to cause that muscle to contract. And then this side's a lot tighter, so it's harder for me to grab. I'm grabbing like this. So my knuckles, finger knuckles going in here and the thumbs on the outside. I've got it. Now I'm going to let go. I'm going to gently pull. You can rub, you can do this. You can lightly rub it. It may feel a little tender, especially if it's really tight. So in that case, you may not want to grab it, okay? You may want to just locate it and find it, just so you know where you're touching, and then you can just lightly do this. And just lightly do that. Just doing this, honestly, on a daily basis to yourself, while you're at the computer, you'd be surprised. You will feel your joints move. You will feel things sublux, as they say, and that's the chiropractor term of of cracking joints is when they sublux. So you can do this like when you're sitting in a chair at the computer, you know, put a little sticky note on your computer, take breaks and rub this muscle, because you're like this all day long and you're like this all day long. So this muscle here is basically pulling. It's pulling your collarbone up. It's contributing to your shoulders being like this. You're already like this, so your collarbone's coming up. So this muscle is shortening every time you do that. So if you can massage this area right here, you'd be surprised at how much pain you would actually be able to relieve in the back part of your neck. So that's my demonstration. Thank you very much for joining me here. I do a full 2-hour couples class in Florida. I reside in Maine at the moment, but I make monthly trips to Florida. When you jump on to one of my live demos, be it a Zoom or Facebook Live, I do offer a $100 off coupon. So make sure you get in my email list, check me out on Facebook, keep up with when I'm doing the live demos if you want a coupon. I do have some openings in March, March 16th, 17th, and 18th for a couple spots of a couples class. And there are some dates in April to come soon. Thinking April 10th and 11th. I might have a few spots in April on those dates. But if you follow me on Facebook and if you get in on my email list, you will you'll be able to keep up with those dates and book a full 2-hour couples class. Full 2-hour class is either the entire 2 hours on one person, or we can switch. One person gets an hour, the other person gets an hour. And it wouldn't necessarily be sitting in a chair. I don't bring a massage table unless you have a massage table already, but I work with whatever you guys have. Most likely it would be a bed. I would have the person lie on the bed, so that way the giver can learn how to massage the person with some proper ergonomics while the person's lying on the bed. And it's not a full body. I can't teach you how to massage your partner, you know, in an hour doing a full body massage. But however, I can have you pick one area, like let's say the back, and I can show you some really good moves and things to do to help that person with any kind of issues that they may be having. Or if just one person wants to receive the massage, we can pick 2 areas and the entire 2 hours can be spent on the one person. So it's entirely up to you. So again, I'm Rebecca with Healing Heart Wellness, and it's been my pleasure to show you guys this little demonstration, and I hope to see you guys for another one in the future. Thank you so much. Have a great day.